Sa lalong pagluluwag ng mask mandate sa Pilipinas, sinabi ng DOH sa isang panayam na hindi malabong tumaas ulit ang bilang ng mga bagong kaso ng COVID-19 bago matapos ang taon.
At kaugnay nga po ng balitang yan, makakapanayam natin si Father Nic Austriaco ng OCTA Research. Thank you po for joining us, Father. Good evening po.
Good evening po.
Good evening, Father, and welcome to Frontline Tonight. Sorry.
My first time on
Nalito
this
sa dami
show.
ng shows.
I almost said the Chiefs. Well, Father, I'm sure you heard about yung sinabi nga ni Yusek Berhere na maaaring pumalo ng 18,000 yung daily new cases by December with the proposed no masking policy for indoor spaces already. Are you seeing, is OCTA Research seeing the same numbers? Are you seeing the same trend?
Well, I think I have to point out that the DOH said there's going to be a range,
Yes,
the
sir.
low range of 2,500 to 18,000. And really given, and the height of the surge is determined by the population immunity. And as we saw recently with the BA5 and now the XBB, there is significant population immunity, at least in the NCR in the Philippines. So we're expecting on the lower end of that range, certainly not 18,000. The Delta was about 20,000 and we had no immunity then. Now we have significant immunity from vaccinations, boosters, and all the previous Omicron and other variants that the Filipino people have suffered.
Okay.
Father, sa akin, unang tanong mula sa akin po ay yung timing lang po nung pagluluwag sa masking, mag-uundas, magpapasko, parties, sale sa mga mall, reunions, magsasama-sama yung mga tao. Safe bang sabihin na voluntary na muna yung indoor masking kapag ganitong nasa panahon tayo, nasa season tayo na magkakaroon ng mga parties o pagsasama-sama yung ating mga kapatid?
So the data from Singapore shows that the XBB is the mildest variant so far. So in fact, if we are going to remove masks, remove the mask mandate, this is the safest time because it is the mildest form of the variant. And we will have to learn how to live with this virus because this virus will be around for the next 100 years. When the Lord Jesus returns, the COVID-19 will be there to meet him. So we will have to learn to live with it. And, this is the time we have a mild variant in the population. We have significant population immunity. So we have to learn to live with it now. And the individual Filipino has to take on the responsibility for his health and his family's health to decide when and where to wear the mask. And I agree with OIC Rosette Vergere. We have to learn how to know when to protect ourselves.
Well, Father, nakakatakot naman sinabi niyo na when the Lord Jesus comes back, COVID will still be with us. Although I also understand what you mean. It's going to be with us permanently. It's just
It's permanently.
Yes,
You know,
sir.
when people say there is a COVID-free Philippines, there will be no COVID-free Philippines. COVID will be here forever. So we have to learn to live with it now. And the numbers are relatively low. The hospitals are very secure at this time. So this is a time for us to learn how to live with it.
But Father, let me go back to something you said a while ago that itong XBB is the mildest form of COVID that we've seen so far. That's news to us because the last that we read, at least in our limited understanding, is that it's the most infectious, but there was no evidence as of yet. The last time we read.
So it certainly is the most infectious, the most transmissible. But the data from Singapore, because Singapore has gone through a surge of XBB in the last few weeks, what they have seen is that, yes, there was a surge, but very few people actually were hospitalized as compared to other variants of COVID-19. So it seems to be the mildest so far. Now, if you are unvaccinated, it will still be very difficult. It's very important that we are now speaking in terms of a vaccinated population. So I have to tell our kababayans who are not yet vaccinated, please go get vaccinated, please go get boosted, because no matter how mild the variant is, if you are not protected at all, then it will still be quite rough for you.
Father, forward-looking, we would like to know your recommendation sa OCTA. Sabi, baka posibleng umakyat ng 18,000 cases per day. Paano kung magkaroon nga ng surge, pero sinasabi nyo mildest form naman? So kung magka-surge pero mildest form, ganun pa rin. Hindi kailangan maghigpit sa masking. Hindi, bawi, mag-mask tayo ulit.
So
Ganon?
first of all, this is I'm speaking for myself today, not from OCTA, because we have not yet really discussed it amongst ourselves. But even if the numbers rise, what is most important is the hospitalizations. And given the data from Singapore, even if you have a surge, we do not expect the hospitalizations to increase dramatically to threaten the healthcare system. So really, we should watch the healthcare system, especially the ICUs. Now, from Singapore, it seems, Singapore removed all the last remaining pandemic requirements in the middle of their surge. And the surge went up and it went down. It took 1.5 weeks. And they are now on the downside of that XBB. And I believe that, after having a conversation with my colleague and friend, Dr. Guido David, I think that the NCR also has gone through the XBB already. And we're also on the downturn for XBB. And so this is very hopeful that the population immunity, the hybrid immunity, at least of the capital, is quite robust.
Last question sa akin, Father. Of course, you're talking about XBB, XBC, kahit magka-surge, okay lang na lumuwag sa masking. But it's a different story altogether pag nagkaroon ng ibang mutation. Tama?
Yes, so clearly, if there is a new mutation, a new variant that is not Omicron, and it is more serious, then we would have to consider returning to the minimum public health standards that we had in the past, because that would threaten the hospitals. So it really depends on the threat of the hospitals. If the threat of the hospitals is minimal, then we can continue to learn to live with the virus. If the threat is big, we have to return to some of those masking and minimum public health standards to protect our hospitals.
Father, let me go back to something you also said that I think is it's a sort of a bombshell for us. First time we're hearing about this. Sabi po nyo kasi, it appears in your conversation with Dr. Guido David that Metro Manila has already gone through XBB and it's already in the downturn as far as XBB is concerned.
Well, so what's striking if you look at the data that Dr. Guido David keeps track of, is that in the last few months, the capital has gone through 2 surges. The first surge was clearly BA4 and BA5. And there was a surge the last month, and we were not really sure where that surge came from. But once the DOH revealed that XBB has been in the country really for more than a month, one hypothesis is that the second surge that we experienced in the capital over the last month is actually XBB. Now, this is a hypothesis. We will wait for the DOH to confirm. But I would not be surprised if we are already past XBB in the capital. The DOH reported XBB in the province, but you have to understand, XBB cannot go to the province without passing through either Cebu or Manila. So if it's in the provinces, it had to enter Manila. So the recent surge, the second surge, the surge in basically October, to explain it, the best explanation is actually we had a mini XBB surge already. But again, I will defer to the Genome Sequencing Center to confirm this.
Opo. Pero Father, just tell me if I got this right. By your estimation, kasi most people are worried na baka we're going to see an increase pa because of XBB and XBC. But by your estimation, we've already passed the hump.
Yeah, so if we are correct, and again, this is just speculation on our part to try to explain the most recent surge, the mini surge. If we are correct, then we are already past the hump. And if you look at Singapore, the XBB surge was lower than the BA4-5 surge, and that's what we're seeing here as well. So in Singapore, the surge lasted for a few weeks. Same thing happened here. So we're hopeful that in the same way that other countries, when they lifted their mask mandate, they did not see a significant surge, that in the Philippines, we will not see a significant surge, primarily because our kababayans will be responsible and not everyone is going to remove all their masks all at the same time. In fact, an OCTA survey has shown that a majority of Filipinos intend to wear their mask even without a mask mandate into the foreseeable future. And that's really healthy because that means that our kababayans are taking responsibility for their own health and we will protect each other in the long run without a necessary government mandate.
Father, my last question, and I suppose to some people it's probably the most important question, kamusta po yung inyong beer vaccine na ginagawa?
So this summer, so it's been good, and this summer we hope to do a direct challenge I have to return to
Wow.
the United States. This is where we vaccinate mice, vaccinate our mice, and then we expose them to SARS-CoV-2, and we see if they get COVID. So I have to return to the States this coming summer in order to test the vaccine directly.
Well, Father, that's summer in the States, no? Kasi dito sa Pilipinas, ibang summer eh. So you're talking about...
June, July, August.
Oh, okay,
The American
okay.
summer.
And we're talking about the bivalent vaccine, Father? Bivalent beer vaccine?
So we actually have, we have variant vaccines for all the variants. So we have Alpha, Beta, Delta, Omicron. And it takes us a month to make a variant vaccine. So whatever is there, we will just make it and test it. So, but right now we just want to test the basic Omicron version just to see what will happen, whether or not it will protect animals against getting sick.
All right.
Okay, different flavors. Huh?
Oh, different flavors, yeah. Maraming salamat
Thank
po
you,
sa inyong
Father.
oras, Father Nic
Salamat po.
Austriaco.
Good night.
Good night.
Salamat po.